But they have the right team members. I say without your team, I always use the word, like you made it through dental school by yourself, congratulations. You need a team.
Right.
You're not doing it all. Associate, it doesn't matter if you're own your own practice. Without that team, you can't move it. You can't move that needle.
Case acceptance and treatment planning. Earlier today we were talking about cash flow, and obviously, kind of segues into case acceptance and treatment planning. And cash flow obviously is, you got to sell the treatment to make your money. We've been fortunate in, our realm of, that's really what I do all day, to be frank. I say all the time, I'm an office manager and I'm all these wonderful things, but I'm really a glorified treatment coordinator. I mean, I sell all the treatment. That's what it is. It's fun. It's good. It's very rewarding to see patients go from, maybe not having any knowledge about dentistry at all or what's going on in their mouth to really saying yes and then seeing it on the other side of it once they're finished and done. I think having the right person in that position is super duper important. You got to have somebody who's really caring. I don't know how they chose me for that.
Here we go.
But Lindsay, and it starts. But you do have to have somebody pretty, that cares about other people and those kind of things. And I think, obviously, I know you guys can attest to some of the mechanics around that and like the tools that you guys are using in your client offices or with yourselves in regards to how that's working. So I know you have a lot in the AI realm right now and a lot of the things that are integrating with softwares like Curve and so share maybe a little bit about that.
Yeah, it's really interesting where we're going. It's kind of cool, the new stuff that's coming out. I mean, it's how often do dentists get new tools and toys, and now I feel like we're getting new tools and toys. So I know the AI imaging was not created for us, but I'm having a ton of fun with it, right? So being able to show patients with colors, like what kind of treatment that they need, because used to be before we would just say, hey, where's that? Do you see this here, this dark spot here? This is the filling that we need to do for you, and they would just nod, and you knew that they didn't. And what brought it home for me was one time I said, you see this dark spot on here? And she was like, yeah, and she agreed to do the work. And she goes, what about that other dark spot? And I said, what are you talking about? And she pointed to the pulp of the tooth. And she said, what about that? And I said, oh, no. And then I figured, okay, all the dark spots look the same to this woman. So having AI is just the image pop is really fantastic.
Those percentages, I love it. When you can pull up this is 70% into this, I'm like, ooh. And then the patients are like, and then they're like, okay, yeah, I'm ready. Like, I'm done. And then, so it's that part is really cool.
This is toast before Christmas. You got to get this done.
Yeah,
right?
We don't get to see all the fun. We love Pearl, and, we love, utilizing that. And so, same thing. But I think being perio, we don't get to play with all the fun things, in regards to, all the fillings and the cavities and all of those things. But we do get to see with the perio chart, similar, in Curve, where you can actually, it kind of takes away the numbers, and the patients just see this, huge dip, or the soft tissues like this, or the bleeding points, and it gives all this red, and they're like, oh my gosh, they can really visualize it, and it takes out all the confusion of all those numbers all over the place. Because I know me, when I get a lot of numbers, I'm like,
it's overwhelming.
It's overwhelming. It is overwhelming.
And I think education is important for the patients, and I'll say for parents. But I deal with a lot of pedo practices, and the parent to understand. And I joke and say, if my kids have cavities, I'm like, shh, don't tell anybody. I work in the dental industry. And when my younger one said, I have 4 cavities, I'm like, shh, we don't repeat that ever again. Delete.
Nothing to see here.
My mom's like, he has 4 cavities? I'm like, no, he doesn't know what he's talking about. So I think when they're chair side, have their child in the chair, and there's doctors going on and on about this, and then potentially IV sedation or oral sedation. It's so overwhelming to have that information in front of them to see, and potentially a lot of times they're like, well, my husband's not here, or my wife is not here, or I'm grandma. How can I take this information to them is being able to email that information to them to view. You know, I say the technology and the tools that the office has is so crucial, because a lot of, okay, let me print this, let me scan this, all that, it's like more work that the team can't keep up with. So I think if you're utilizing the right software program and the tools, then the mom's like, okay, honey, I just texted it to you. Can you look at it? The office just emailed it to you. Can you look at it? Because I want to go ahead and schedule, because their next IV sedation date is maybe 2 months out, and they want to get it done.
Early access to, think about it, like hygiene, right? Like hygiene, sealants, you know, the hygienists presenting sealants, and the parents are like, I don't know, or mom's not here, or let me ask mom, or this and that. But if you can kind of show them, like, okay, look, this is what we're trying to do, or this is where we're seeing these areas, and get the sealants happen, they're probably going to do it right then and there. So that's going to boost that hygiene revenue as well, which we all need nowadays. Smart. Which we all need nowadays. Love you, hygienists. Love you.
But you know, it's one of those things where if we make it easier for them, and we live in a visual world, so why not make the tools that we need to have, make it visual, and everybody's used to seeing that. If they see, because they're not in pain yet, right? And how many times have we heard, well, if it doesn't hurt me, then I don't need to get it done. Well, wait a minute. If we can proactively keep you from getting in pain, and oh, you know, Mrs. Jones, we know you travel a lot, so why not go ahead and get this scheduled today so that you don't have to miss work, miss the next conference, miss whatever. It's the bigger picture of wrapping everything up in a nice bow for the patient to say yes.
So I was just talking to an office, and they have had Pearl in their office for about 1.5 years now. And their favorite trick is to pull up the bite wing from the last time and the bite wing from today's visit, and they can see the progression. If they've been telling them, look, this needs to be done, especially for bombed out teeth, that they've been trying to say, look, this needs to be, you need to address this, it's going to get worse. And they can literally see the color, the big flare of color just getting bigger. And they said they don't even have to say hardly anything. The patient's like, oh, I get it now. Because when you tell someone it's going to get worse, like you said, if it's not hurting, they don't believe you. And we all know the holidays, it gets worse on the holidays. If you say you're going to close your office,
everybody's in pain.
Everybody's in pain. And so we need to like get that point across.
Same thing with bone loss. Happens same exact thing with bone loss. You pull up the x-ray from prior and you pull them down, and now you've got these lines. I don't even know what they're called. I just call them the lines, like the lines, the lines on
the clinical attachment.
Yeah, the CJ.
I'm going to Kansas. She's like the lines.
I was an office manager of the year. Don't.
I know. Next year I have a lot of swag.
Don't judge me. I know you got all the swag. Come on. The lines, okay, get longer, and then that's more bone loss. So it's like makes your job a lot easier. But
it's true though, when you've got that, like the BOLA AI that they have. I mean, you can pick it up, the perio charting, and you can see they can even like give you a guesstimate of where they think it's going to be based on, you know, your history and all of that. But just my best, I mean, this is back when I was treatment planning, you know, in the office 24/7. It felt like it anyways, 24/7. I would show them the
glorified
perio chart.
Treatment coordinator.
Glorified.
That's your new title.
I'll take it. I would take the perio chart from before, and then of course when they were improved, as you know, when they come back, and then show them the tightening up and the reduction, and it was a real, I mean, they can see it. And I think that's the point we're all trying to make is the visual aspect of it.
And then we get a Google review.
Yes.
I'm like, here's where you were. Here's where you are. Didn't you do so great? Google review.
And I think the presentation is so key. I mean, you know, as you are doing that all the time, but that's what I talk about all the time to my front desk teams or the treatment coordinator. I say, you know, that presentation, ideally chair side, if you have it on an iPad, so that you're not, and depending on the layout of the practices, sometimes they have no privacy. There's no treatment room, like coordinate, like, you know, to go into a TC room and have that private conversation with that patient, with that parent. Doesn't matter what, you know, specialty there's. I think that there's a lot of emotions involved in that. To be able to have the technology to pull up an iPad and have the ability from the software to show those. And I know you had mentioned like not seeing the numbers is important, something new that I learned, I'll say, from you, because I didn't realize that part could be overwhelming for them. And showing that, and then being able to hand that off to the front desk to then, you know, I don't know, email it, print it, have it signed so they can schedule. All of that is efficiency and probably will help with the manpower that you potentially are lacking in your practice so that you can have a higher conversion rate.
Yeah. You definitely have to know, I mean, you have to know your patient. There are some patients that want all of those, you know. I mean, and I might have said this to your husband earlier. He's an accountant. He might want all those numbers. He wants all the numbers.
He wants all the details. If there's an implant involved, he wants to see the studies. He wants to see the packaging.
But you know, that's no different than presenting to all the different personality types of our patients, because some want the numbers, some don't. And then it goes back to communication of how do we get our patients to say yes and give them all the information. And with all of the tools that we've already mentioned, the job's done for us. Now it's just how do we communicate that to the patient.
Let me ask you a couple questions. Okay, so let's just do like a quick round robin. So chair side or in a consultation room? What's your preference?
Chair side, for me.
I will say a combo.
I mean, there's no right or wrong.
I will say a combo, and I will say for years I really believed consultation room was the best area to do it. But what I have found with technology today and the ease of treatment planning chair side, and the hygienist or the dental assistant getting the treatment plan in and the orders in chair side, just like, you know, Curve can kind of set it up to outline it so that there's a little bit less communication. It sets my dental assistants up for success to where I wasn't sure that they would have that before. But I will tell you what that frees up. It frees up this whole the way we have it set now is I would used to present everything. It was always done in a consult room, and that was just what I believed to be true. I was stuck in my own ways. And now what I realized is with the addition of all of these things and the technology and the software technology and those things, you can turn this all the way around, which then frees up more sales to happen because we now just set a system. I know they're not going to walk in and present a $20,000 treatment plan chair side, but are they going to present a $2,000 or $3,000 treatment plan for some scaling or something like that chair side? Absolutely, that's going to happen. So it's a combo for me, I think, of both. And I think the technology has helped me feel secure in that happening. And we just set a system. We set a cap. We set a whatever, you know, under this amount, it's going to be presented chair side. Over this amount, we're going to go to a consult room. Sometimes it's personality of the patient, like Lynn kind of mentioned.
I was going to say, for me, I think it depends on the personality of the patient and what exactly you're talking about and the setup of your office. Because to your point, Malika, about sometimes you need more privacy than others depending on what you're talking about. Some people, if you're going over a very large treatment plan, there's some shame or some embarrassment that could be there. So it really depends on what you're talking about. But I believe in both. But I also believe in empowering our team to make that choice of what do you think is going to work best for the patient, because it's been diagnosed. Now we need to take care of our patient. So at the end of the day, somebody needs to make that judgment of where do we need to go so the higher probability is that they say yes.
So scheduling in the back versus taking them up front and doing a handoff.
And I think Lynn said it really well. I think if you're in an office where it's open bay and there's no privacy, then you probably need a room, you know. And if you don't have that, it makes it challenging because I feel if you're talking about $5,000 or more, there's a lot of emotions involved in there. I feel.
Yeah.
I think it's important to have like the time or the privacy to be able to go over. Maybe they need some financing. They can't do it all up front, or they're just emotional about it. Right. There's a lot of those pieces that come into play.
People that are embarrassed.
I kind of think it's a mixed bag on scheduling too. Scheduling, I really think from a hygiene standpoint, should happen in the back with the hygienist, because they are the ones who really the patient's buying into a lot of the time is the hygienist. Yes, nowadays when you have a lot of temp hygiene situations, other things like that, we call them guest hygienists. But when you have guest hygiene in your practice or other things like that, they may not be as dedicated to that one specific person, but it's still attaching that patient to that physical space of this is where I'm going to be in 3 months or 6 months or whatever.
Right.
To where assistants don't always have that same amount of time, and I do think it's more important for that administrative team to bond, especially with that physical appointment confirmation from that. Plus, there also sometimes is money attached to that as well, which hopefully doesn't happen a whole lot in the from the hygiene section. But
there's a question that we all have faced over the years. We've all been in dentistry for a long time. I'm sure that you've trained people and they've said, "Well, I'm not a salesman." So, is dentistry sales? Do we have to be a little bit of a salesman? Is sales a dirty word, Beverly?
I was at a okay.
I want to see what she has to say.
I was at a course. Probably this has probably been about 15 years ago. I was at a course, and it was implant sales, or implant presentations, I should say. And I used the word sell, and the instructor from the stage, you know, some probably older oral surgeon or periodontist, you know,
Not probably.
decided
She's saying
to
it was.
I'm saying it was, you know, dinosaur. Sorry, no, I'm just kidding. I'm just kidding. I'm just kidding. I have one of those in my life. So.
She's an expert.
I am an expert. So he admonished me. He was like, we don't sell things. And no, it is sales. You are a business, and it is a sale. A sale is not a negative word. It is a transaction. You are agreeing to give the patient something in exchange for money. And that is a sale. That is the whole definition of a sale. So I definitely think selling is not a bad thing. You have to sell things to make your practice go well. And I think that is something that there shouldn't be any negative connotation around at all.
I agree.
It really, it should be a positive thing. And you are selling for the greater good of the patient and the human. And those ethics need to remain in there in regards to those sales. But sales is definitely not a dirty word. It should not be a dirty word in dentistry. We are all in the business of dentistry. That's what we are.
We keep our doors open and we can do more dentistry. That's really the simple.
And we can employ people, and we employ a lot of kinds of people in our practices, single parents, and you know, some people maybe that haven't been here that long, or other things. You know, there's a lot of
great opportunities.
There's a lot of great opportunity in dentistry, but we have to have sales to be able to make that work. So
I mean, when do we get to a point that profit is a bad word with us running businesses?
But I think in dentistry it's always been that way.
It has.
Like it's always been, you know, we are here,
and then
yeah, like even I mean, how long ago we couldn't do any advertising? Like if you put out an ad, all the veteran dentists were like rawr on the new guy, you know,
that's so true.
coming out. So I think things are very, very different now, and I'm glad to hear that we're talking about this. But I do hear some, I mean, they're not even dinosaurs. I still hear people saying sales. It's not sales. I am not a salesperson. You know what?
They get very offended by it.
They do get very offended, but I think we need to, there needs to be a difference. We're not used car salesmen, for crying out loud.
well, even some of those dinosaurs are really good salespeople too. So.
Well, to your point,
for
my clients that like if the dentist is just that apprehensive about saying we don't sell, I'm like, well, do you influence? And they're like, oh, wait a minute. And I said, if you influence someone to be able to take care of themselves, I said, I don't care. Let's not get caught up on the label. Let's just make sure the patient's taken care of. Mm-hmm. You know, so I don't think we need to get caught up on that label. And I found that works well with my clients. It's like, well, you influence it. So I just want to make sure that you influence in the best way to be able to get your patient to say yes, as long as you diagnose correctly. Or did you diagnose correctly? And, well, yes. I said, okay, then let's make sure your patients are taken care of.
Now, that's a great point, because honestly, the pushback that I get on that is usually from clinical people, because that's not what they went to school for.
No,
so
and it's a dirty word
it.
to them.
Yeah.
But they have the right team members. So I say, without your team, I always use the word, say, you made it through dental school by yourself, congratulations. You need a team.
Right.
You're not doing it all. Associate, it doesn't matter if you're own your own practice. Without that team, you can't move it. You can't move that needle. So have someone, a treatment coordinator, someone that has that fire and that drive, and provide them the right tools. Drives me crazy when I'm like watching a practice and this girl is put in a position to sell, and the doctor's telling me that she can't sell. She's not able to. But I watch her. She can't. The system she has can't print the treatment plan right. The settings the fee schedules are not in there. This poor girl's sweating. This patient's staring at her while she's trying to. She's put out for failure. Give her the right tools so that she can do what she needs to do. You know,
make sure it is sad. Make sure they're comfortable with it too. I mean, I don't know how many times I've seen in offices, or maybe in previous employees of my own.
Here she goes.
to wear. Are you afraid? She's like, I'm afraid of what she's going to say.
No names.
No names. To where they would be like, okay, so that's going to be $345. I'm sorry. And I'm like, yes. I'm like, okay, we're going to start over. You know, that's going to be $345. So, you know, giving them the education and the training, and also make sure, I mean, sometimes I think one challenge is that sometimes doctors will put on a person to present something that they're not 100% comfortable with. You know, if you have someone who, in some of these, you know, all on X and all these other bigger, large case treatment plans, you've got somebody who some of that might be their salary for the year or half their salary for the year.
That is the key.
And you're asking them to present this and to bring this in, and they're automatically, as human nature, going to put their own
Self in that position.
self into that. They're going to interject their own self, and they're going to be like, there's no way this patient has this, or they're going to have their preconceived notions about what that's going to go like, or they might be nervous to do it. So just making sure that they're backed up and they have the proper training and help needed to be able to do that, and that they're comfortable. Ask them. The doctors can just ask them, are you comfortable, or what are you comfortable with? Let's talk about it. Let's role play it. I know everybody's not a fan of role playing all the time, but it works. I love role playing too. Well, we all do, but I mean, those people in those dental offices working do not like it.
My other tip on this is to hire people who used to work in jewelry stores. My best 2 employees worked in jewelry stores previously, and when I would say, do you have any issues presenting some of our treatments, 5,000, and they would look at me like, that's like one set of earrings. Like,
I can handle
what's
that.
the problem?
Yeah, that's a good
That's
tip.
what you need.
Right. Yeah, no, that's smart. That's actually really smart. That's a good tip. I'm going to use that one.
I try.
I'm stealing that
Try
one.
to bring some.
I'm stealing that one. Okay, definitely. I am. I'm
She's
using
gonna
it.
hashtag it.
When you guys see Carl A. Smith DDS LLC jewelry store clerk wanted,
There's like an underground jewelry store employee, I'm sure. Like, we gotta put out our
jewelry
ads
store
there.
clerk / treatment coordinator. I'm trying to replace myself.
Good.
So, we've got a lot of new things. We got a lot of new job ads to put in next week, and we really, we're just really appreciative of Curve for supporting this and for giving us a platform to be able to give our knowledge and fun and wisdom to the world. And we hope to see you on another episode soon. Please like and share across your socials.
Subscribe.
And subscribe.
Yes, yes.
She keeps me on track.